Hi, everyone, and welcome to the Thrive Co-Living Communities YouTube podcast. I'm Mark Stein, Thrive founder and your podcast host. We're creating sustainable, inclusive, and multi-generational residential communities. Our mission is to combat the epidemic of isolation, revitalize communities, and help others discover the many benefits of engaged community living by offering unique and ecologically sustainable co-living options. In this podcast series, join us as we discuss co-living, in addition to bringing you interesting people from around the world who are doing cool things to expand your knowledge and satisfy your curiosity. Through this podcast, learn more about our concept and see how Thrive co-living communities will bring together people from all walks of life who want to enjoy the best of independent and group living. To find out more about us, please visit our website at thrivecolivingcommunities.org. Thanks for watching and enjoy the podcast. Hi, and welcome back to another episode of the Thrive Co-Living Communities podcast. I'm your host, Mark Stein. I'm excited today to chat with Janet Blum, a licensed health insurance agent based in Sarasota, Florida. As a health insurance agent, Janet helps people find health insurance, Medicare, as well as dental, vision, life insurance, and more. She has a hands-on approach as well as a compassionate approach. She's all about helping people find the care that they need. So welcome to the Thrive Co-Living Communities podcast, Janet.
Well, thank you very much, Mark.
So, Janet, why don't you talk a little bit about your background and how you got to this spot, both in Sarasota as well as your work, and just sort of summarize how you got to this point.
Okay. So, when I was younger, I thought I was going to be a doctor. And, in undergraduate school, I was pre-med, and then just decided that really wasn't the right course for me. And the college that I was attending had some graduate level courses that I was able to take that were more business and health related, and had advisors that thought that it might be a good idea for me to get a master's in health administration, which I subsequently did and attended Duke University and got my master's in health administration. Upon graduation, I was always more interested in the financing and health insurance and whatnot. So initially worked for Prudential in their corporate office, but I was the user liaison supporting people that were using a computer system to do their billing and eligibility for employer group insurance. So from there, I actually was a stay-at-home mom for several years. And then when I was looking to get back into the workforce, looking at various ads and whatnot, I became intrigued about, well, what about becoming an insurance agent? And I really, knew very little about it, and kind of just went all in and started initially with an agency where I was a captive agent with a Blue Cross Blue Shield agency. And there I was able to get a lot of training and understanding of how health insurance works. And this was before the Affordable Care Act. So, I got to see, what's involved with underwriting and whatnot. And all through, subsequently then, the Affordable Care Act came into being. And I then became an independent agent because I really like the ability to, work with the people that I wanted to work with, offer, various products, and, be able to educate people and, grow relationships over time. Since I've become an independent agent and the ACA started in 2014, I still, have the early clients, they're still, with me to this day. So it's, building relationships is what it's all about.
And now it seems that you have a two-pronged approach from our earlier conversations. And let's start with Medicare.
Mm-hmm.
And that seems to be a core part of your practice. Talk about some of the issues around Medicare. Um, it hits at a time in some people's lives that their cognitive cognitive abilities start to wane. Um, Not me, of course, but a lot of people. Uh, and, uh, it can be quite confusing and burdensome to try to find your way through that system without help. So talk a little
Correct.
bit about that need and what you do with seniors that are approaching Medicare and how you guide them.
Very, very good question. So, I work with, Medicare people at various ages. I have clients from, you know, even younger than 65 because people who are on disability can get Medicare at younger ages. The client that I recently worked with, I believe he's 38. I think that's my youngest Medicare client. And then I've got a neighbor in my neighborhood who's 97. So I think she's my oldest client currently. And
And she's just getting Medicare at
no, she
97?
she's
Oh,
no, she's been on Medicare for
okay.
quite a while, but she actually needed help. A few years back, she was a retired teacher from the Chicago school system, and they had a retiree benefit plan, and then they no longer had that plan. So she needed to get a regular, figure out how to do things the way people without employer or retiree-based coverage do. And it's needed to be educated on, everything from, what Medicare covers to what's Medicare Advantage, what's Medicare Supplement. And so it's, as you had mentioned, these are very complicated discussions and situations. And so, when I can, I like to meet, in person with people because I can generally gauge their level of understanding a bit better than over the phone. I can see their facial, reactions and things like that. So they know that I can, make sure that I address all of their concerns. Um, and it's a lot of education. And then once I have all, gathered all the information, it's trying to do kind of an analysis of, well, what's going to work best for this particular client, especially with medications. I've got clients from, I'm not taking any medication, so I know, the proper plan for them. And then I've got clients that have a laundry list. I think the most medications I came across recently from a client was 23 different medications that they were taking. And so
Oh.
it's trying to figure out, which plan is going to be the best to meet their needs. And so it's not always, the cheapest plan. It's not always the most expensive plan. Sometimes it's, one that's in between. And until you, take the time to do the research to, figure out, how each company is going to handle that medication, because every company has a different formulary and different, also sometimes it's a matter of pharmacies as well. I have some clients that it's like, I'll never go to XYZ pharmacy, and other people that it's like, I'll only go to XYZ pharmacy. So it's that combination as well. Some people like mail order, some people never do mail order, things of that nature. So it's trying to gather all of the different pieces, and it's kind of a puzzle that you kind of try to put together and figure out what's gonna work best for them, and as well as following up afterwards. It's, I'm not one and done type of a thing where, I make the sale and then I don't ever communicate with them. You know, I do try to, follow up with my clients as best I can, and, um, try to see if there's anything that's going on that they need help with and whatnot. And, at times, as you were saying, with clients that have declining cognition, that at times I'm dealing with their family members, whether they're usually on the phone together initially. At times they're they do get the power of attorney, and then I can talk to the power of attorney separately, and don't need to have the involvement of the client themselves because they have the authority. So,
You know, your comment about the 23 medications, I'll share an aside here. Excuse me. Um, Probably half of those medications are dealing with symptoms that are caused by the other half, the first half of the medications. I remember an extreme example. I saw a TV ad about a medication that could help people with dry eyes
mhm,
that, that can't generate tears and their eyes are perennially dry. And I thought, you know, they probably are taking some sort of medication that's drying them out. And then now they're taking something to counteract that. So,
right. And I'm sure that does happen quite a bit, but I'm not a medical professional and just trying to, if the client says, this is what I need to take, then I, adhere to that and try to figure out the best way for them to be able to get that medication at the best price.
sure. Oh, I know it's not your job to talk about taking certain medications. You
Right.
know, there are several major parts involved in the Medicare decision. And let me see if I recall them. And I will say I'm pretty astute, uh, except for not being able to remember names of books and movies and stars. My cognitive ability is pretty good, but
Mm-hmm.
I it was it was very confusing for me, and I did deal with a specialist in Louisville when I lived there to help me
Mm-hmm.
get enrolled. Um, but it was a lot of information, and it was confusing. Let's sort of separate things out for those that may be approaching the age or maybe have made some decisions that could be changed. So we've got
Yes.
Medicare itself. Is that part A?
So Medicare has technically four different parts to it. The
Okay.
one that people generally refer to as original Medicare, which covers the inpatient and the outpatient, is Medicare Part A is the inpatient, Medicare Part B is the outpatient. And it's kind of like the baseline coverage that people need. And then they need to try to figure out from there, what are they going to do to augment it? And what's, you know, complicating matters is that if they don't do things in a proper prescribed way in terms of, that when they apply for the coverage and get the coverage, there could be things like late enrollment penalties that people will be um, surprised about because they hadn't really thought of, that would impact them. And that comes into play when somebody delays enrollment in either Medicare Part, usually Part B and the prescription part, which is Part D. And so those both have fairly hefty late enrollment penalties. I just did a quote for one of my clients' mothers who had never had a prescription drug plan. She's now 87. And, we calculated that her late enrollment penalty was going to be $75 a month. And so it was one of those things where, yes, we can get her a plan, but is it really going to benefit her at that price? So, demonstrate, provided the information to them and they're still considering, what the best approach is. Um,
If
and
she's the one
so,
with 23 medications, it probably will pay her.
yeah, this lady didn't have quite so many, and a lot of hers were inexpensive generic. She was just on one brand name medication that was costly, but it was also the number one medication that Medicare is looking to negotiate the pricing on that would, I think, go into in 2026. So there's lots of changes that are happening, mostly with the prescription drug coverage due to different bills that were passed recently by Congress. And so, and it's the design is for it to help all of the people on Medicare And we're still kind of waiting in the wings to see if that's going to be the end result. So right now there's some low cost plans. There's actually a zero premium plan that's available for prescription drugs this year that I venture to guess next year it will be not be a zero premium plan. So I think they did it to, gain market share, to say, hey, come under our umbrella and we'll take care of your medications. And then, so anyway, that's kind of in a wait and see type of a thing in terms of what the result of the legislation is going to be in terms of next year will be the first time that there's an out-of-pocket cap on the amount that a beneficiary will pay for their medications, and that cap's going to be $2,000, and that's a really good benefit for the beneficiaries because right now, due to other changes that I've come across, that people could be paying upwards of four or five, $6,000 a year for their medications, and generally people who are on Medicare are on a fixed budget and really can't afford additional expenses that would come into play with getting prescribed a new expensive medication. So that's going to be an interesting thing to see what happens this year. Kind of digressed a bit. So, going back to
No,
explaining.
I took you off your game. So yeah, let's
Okay,
get
okay.
back to
Anyway,
Medicare A,
right.
B.
So when somebody has Medicare Part A and Part B, then they can decide, whether to get what's called a Medicare supplement, which, is kind of exactly what it implies, is that it augments or supplements original Medicare. It fills in the gaps and it limits people's out-of-pocket spending for their health care side of things. So earlier I was talking about the prescription costs, so this is just on the medical costs, and so I have some clients that opt for that type of a care, but it doesn't uh, entail a monthly premium. And at times I have clients that say, I can't afford that monthly premium. What else do you have to offer? And so the other option, and this is kind of a wide overview, but the other option is Medicare Advantage. And, we're very fortunate in our area that we have several really good plans offered by, the national companies, as well as some very uh, good regional or local, more localized companies that have come into our market. And the plans and everything is uh, garnered by what county person lives in. So there's some plans that will be available in Hillsborough County that won't be available in Pinellas, and then there will be some plans offered in Sarasota that aren't offered in Manatee and things like that. So it's just trying to, identify, with everything that they provide to me, because when you are in a Medicare Advantage plan, it is a managed care plan, and then and you do then have providers to be concerned about. Is the provider in the provider network? And that's a main, sticking point. And so, always try to align as best I can with, getting as many of the providers in the provider network as possible. Recently it had talked to somebody who was, on Medicare and Medicaid and was interested in getting a Medicare Advantage plan. And it came down to, well, either you want these benefits that you're saying that you want, because the Advantage plans offer additional benefits, and they, offer things like a gym membership and some dental and vision and hearing and other things that aren't included in original Medicare or in a supplemental plan. And so, it turns out that, yes, she definitely wanted to go with the Advantage plan to have access to the extra benefits. And there were, two providers that she was going to have to try to find new doctors for, but it wasn't, that wasn't her primary care doctor. It wasn't her specialist that she was, needing. It was, kind of like an ancillary doctor that she didn't see all that often. So it wasn't going to have as major an impact as it would otherwise. So it's,
Mhm.
um, so that's, part of, what happens is trying to just match as best you can. Oftentimes there aren't necessarily, one answer in terms of, that, oh, this is the only plan that you should look at because of, this, that, and the other thing. It's like, there's usually a few different plans that offer, somewhat similar benefits. So it's trying to get a feel for, what's going to work best for them.
My recollection is that the advantage, pardon the pun, of the Medicare Advantage was low premiums, but that the drawback is that there are some situations where there are high caps, uh, high deductibles, and sometimes unlimited uh, out of pockets. Can you talk a
So
little bit
no,
about that?
the Advantage plans, one of the nice things about them is that they do cap. They do all have what they call maximum out of pockets. And that's on the medical side, is that they all have to have a maximum out of pocket. And the upper limit is set by the federal government every year, so they can never exceed that amount. The plans near us are actually, really trying to compete for people in this, neck of the woods where we have, a high population of Medicare beneficiaries. And so, we find even with the more attractive and more lenient PPO plans where you have the ability to use providers both in and out of network, uh, they are competing with each other so that, they keep ratcheting down that maximum out of pocket. So that we actually have some PPO plans in our neck of the woods that have, relatively, lower out of pockets than the national maximum. Um, HMO plans in general tend to require you to go to a primary care doctor to get a referral. And, some people don't like to do that, or, just feel that, that's an extra hoop to jump through. But yes, that's the kind of thing that you were talking about in terms of that, the Advantage plans do have, more cost controls, as they would call it, in terms of, you have to generally get a prior authorization for a procedure and referrals to see, specialists and things of that nature. So but the plans in our area are, for the most part, a zero premium. So that's the draw to them. And for zero premium, you will get, you know, the health plan in general, and you'll have out of pocket. They'll have co-pays for various services that are generally quite manageable. Um, and and in addition, you get the extra benefits that they provide. And again, they're often trying to one up each other, and the companies are all vying for that business. So they're, let's add this year. Let's, so they keep adding additional benefits that make it more attractive for people to, consider changing their plan and whatnot. I've had some clients that it seemed like every year they were really, shopping their plan around, and then um, they, went with a company that looked really good, and then the next year they were gone. So they decided instead to, go with a company that was going to be more stable. And the last couple of years, they actually were like, yeah, we're good. We like our plan. We're just going to stay with it. So it's, oftentimes, I find that, people that use their health plan usually get satisfied with the coverage that they have with a particular company and don't really shop it around each year. It's usually the people that are, you know, trying to be a little more creative and trying to figure out, well, if I go here, I'll get this. And, and it's, oftentimes they're, in essence, shopping for the wrong reasons because, they should be shopping for the quality of the health plan and the medical care that they'll get and the doctors that are in their provider network versus the extra benefits that the company is going to provide. So, it's kind of creates some perverse incentives, but, the bottom line is that you just have to, still try to figure out, what's the best fit for that particular client.
I
But
have
yes,
a,
Medicare supplements plans do have, premium. There are some lower cost premium plans, but the majority of clients that go the Medicare supplement route want the most comprehensive coverage. And those plans generally, if for people that are turning 65, start at around $200 a month. And so that's where, people's budgets can or cannot allow for that in terms of, that's something that that you would have to pay every month versus on the Advantage side where it's like, well, you might not have to pay that, amount for, you know, perhaps even the whole year. Because I have some clients that, just go to their primary care doctor and that's it. And then they don't have to, pay anything for their medical care. So
got it.
yeah, everybody's different and, just recognizing that and trying to understand their circumstances the best you can.
And I experienced something this past year, sort of a nuance and falling through the cracks with the prescription drug coverage. And boy, getting out of the hole, digging out of the hole was really difficult. They're
Mm,
seem very rigid. I have two residences, as a lot of people do, here in Florida, and a notice went to my other residents, and the people that were there didn't forward it to me.
mm,
So um, uh, the company said, "Oh, we're going to just cancel you. No call, no nothing."
right.
And I didn't find out about it until after the period was over, and I didn't get a
Hmm.
prescription filled. That was in January. And getting coverage again was really difficult. It so happened that there was I think we may have even discussed this, there was a hurricane
Yes,
on
special
the
enrollment
other
period.
side of Florida that
Hmm.
gave us a special enrollment
Correct.
possibility. So I was
Right. And
able to get
there's a
in.
lot of discussion right now at the, governmental level of, right now we have the annual enrollment period, which is from October 15th through December 7th, and that's when people can change their Medicare Advantage or their prescription drug plans. And yet Medicare Advantage on that side, they have what's called an open enrollment period. So if somebody were to pick an Advantage plan during the annual enrollment period, and then find out that, yeah, this plan isn't working for me, I want to go back to my old plan, they have the ability to do that from January 1st through March 31st. And there's been a lot of talk of that we need to extend that to prescription drug plans, but currently it's not available. And so we'll see what happens. I see that that could be coming down the pike, but we'll see. But yeah, you're not alone in that regard. This year I've helped, 3 or 4 clients where they were in the situation where, you know, it wasn't intended, but they ended up, lapsing their prescription drug policy and it got canceled and they could not get it resurrected and had to wait for an applicable enrollment period to be able to get a plan started again. And then they have a late enrollment penalty and that's, stays with them. And so and it's through no fault of their own. It wasn't intentional. And I don't think that the prescription drug companies do enough. I think that they could do more to try to save those policies. And, I would like to see something done in that regard. I mean, they have your phone number. They could have called you,
Yep.
that kind of thing. So And yeah, so
Maybe this is something that people could call their congressman, congressperson,
that would be a
to try to
definitely
lobby for.
yes, that would be good step to do, is that if somebody, were to have the wherewithal to contact their congressperson to, you know, actively, you know, lobby for basically the extension of that open enrollment period to include prescription drugs, as well as to come up with some sort of a, more rigid circumstances where the prescription drug companies can lapse your policy, because I think that they do, again, that was the situation, they did send letters to your home address. Well, obviously that didn't help because it's, but it's, there's all sorts of, different things that can come into play, but that's the bottom line, is that I think they could do more. I know that, every month that I look at my own personal bills, I look to make sure that my husband's premiums got paid and things like that. So it's, it's also, looking at it from that side. It's, if you see that a particular premium wasn't paid, you could catch it, early enough. But it takes, it's one of those things, if it's on auto pay, you just, kind of set it and forget it and don't really think about it until you have to. And then it's usually too late. So,
Yep. And explaining it to a congressperson, uh, what the situation was, or even
mhm,
their office, it was so complex.
right.
Um, so let's see, anything else that you'd like to talk about in an educational way about Medicare, the Advantage, the other supplement, or Part D? Have we covered everything, all the major questions and issues people have?
Yeah, pretty much. I mean, I think that, you know, I guess the only thing that I didn't quite mention is that, oftentimes when people are in the situation where they're learning about Medicare, they there are a few things that they could do that I would probably kind of guide them against. Is that one is that they'll fill out a form on the internet where they put their name and phone number, and if they, in doing so, then they get on a list for, you know, it could be hundreds of agents calling them. And so then you don't even want to pick up your phone to answer when your mother's calling, or something like that, because it's like, the phone's ringing again. I don't want to answer it. So that's one thing. The other is that, they ask their friends, neighbors and whatnot, and that, their friends could have a policy that they're really happy with, but it really might not be a good fit for you. Oftentimes I come in across that situation where, that this person, they have, only a primary care doctor and they live in Florida and they all receive all their care here. And then I have this person that's their neighbor, but they're a snowbird and their doctors are in Massachusetts. And well, there's only a few plans that actually cover their doctors both here and there pretty well. So it's, trying to find those types of situations so that you can ensure that they get the care when and where they want to get it. So.
And speaking of that, my understanding is it doesn't cost anything or anything more for somebody to work with you or someone in your position. Is that correct?
That is correct. So, the model of our, you know, our role is that we, provide the advice to, whomever seeks it out, and we do not charge the consumer for that. If we are fortunate enough to, sell a product to that client, then the insurance company compensates us. And so it's, it really does behoove us to be, a good listener and to do that, real the job up front in terms of trying to find the best fit for the client, because when you do, then you have a satisfied customer, and then, they'll A, stay with you, B, they'll tell their friends. And so, it's that kind of a thing, my current model of growth and whatnot is just through referrals, whether it's through my, current client base, or whether it's through some strategic partners that I've, made. But it's just, I'm not one of those that's, out there, dialing for dollars and trying to, there's all sorts of rules about when you can't contact a Medicare beneficiary. And usually ahead of time, you have to have permission to call them before you contact them over phone. So, it's, but anyway, it's that kind of a thing where, I've gotten to the point where, my business is continuing to grow through, kind of grassroots type of mechanisms.
Do I assume correctly that your compensation is somewhat front-loaded so that the major, or is it with a client, a particular client, is your compensation steady over the years, or is it more the year that you sign them up for Medicare and then it tapers off?
I mean, it varies by, product and circumstance. So it's, I mean, in general, and again, this is a very large generalization. I get paid, you know, for each client for each month. And that, they keep the policy in force.
Okay.
So, there are certain situations where they do give you, like, the first year's commission, they'll give you in larger chunks at the beginning, so that, you get greater compensation. But, the bottom line is that you want to put the person in the proper product and the proper, have them have the proper coverage, and, the rest will, come from that. It's, that's really
Right.
the driving force. It's not, well, if I put them on this, I'm going to make this much money. I never, never look at that. So,
Yeah, and I was referring more towards the phenomenon, and mine may have just been a one-off situation, or he may have been busy, but my agent, 3 years down the road when I had, or 4 years, when I had this problem with the Part D,
mhm.
did not seem as motivated to jump on the phone and help me as he did when we first set it up. Also, I think it was a carrier that doesn't work with uh, representatives as
Okay.
well. Um, so,
Right. There are some companies out there that are either, they have their own captive agents. And, so at times they're, I do represent a number of different companies, but there are times that the best fit for somebody is with another company. So at times I'll still have them enroll in it, and I'll show them how to self-enroll, or that I'll, refer them out to another agent that could help them in a better regard. So it's, it's not always that, I don't feel as though because somebody came to me, I have to sell them something that I represent. It's more, definitely trying to find the best fit for them.
great. Before we move to another application within your work, I'm guessing that this can be that working with seniors in this situation, since it's a milestone, um, and freaks a lot of us out when we hit it. Um, and I'm 20 years from hitting it. No, I've already revealed that I'm not, but that it can be really rewarding work to help people at this critical juncture. And I can also see how, given the population and some of the declining uh, states that we've talked about earlier, that it also could be sort of frustrating repeating yourself a lot and helping people totally understand. So, uh, talk about the the intrinsic rewards from this work with this population. What is that for you?
I mean, it's just, oftentimes I'll, get clients that will, either, when I do get them on the phone for something else, they're really appreciative, and they're, oftentimes saying, I'm so happy that you're my agent, and, I know I can call you, and you're going to pick up the phone, and you're going to answer my question or get me the help that I need. And, it is very rewarding from that perspective, to know that you're making a difference in their lives, and helping them navigate through something that's quite complicated, and difficult for most people to navigate properly. So
Good. Well, I'm glad the rewards sound like they outweigh the difficulties. And if you're dealing with the public or you're dealing with B2B, there's always frustration. Um, so got it. So
yes.
talk about the other major type of client group that you
Okay.
work with.
So the other policies are generally through the Affordable Care Act. And the people that I help are either working in jobs where they don't offer insurance, or a large group of the people are self-employed. And then we actually have a bunch of people that retired early, and that they're no longer covered by their employer insurance, because they decided to retire, and had the wherewithal to do so, and are still, a few years away from being eligible for going on to Medicare. So it's trying to fill in sometimes it's a gap between jobs, that somebody has they'll go from having work insurance to having this, and then they go back to work insurance. So it's a much more fluid community, although I, do have clients that have been with me for many years. But yet recently had helped a family where, they had been with me, and then they, got insurance through work, and then her hours got cut. And so now they're back on the insurance through me. So it's always providing the service, so that when, they do encounter the situation where they're in need of my help again, that they'll think of contacting me. So, there's, various different clientele that I encounter. There's everybody from, uh, sometimes I'll come across grandparents that now have to take care of their grandchild and need insurance in that regard. Other times there's young adults that are aging off of their parents' policies, or that, they're now, some young adults are, in their early 20s and are working, and they, have the means to, support themselves, and need to get their own insurance plan as well. Um, and everything from, business owners that are, that I help people both who are eligible for the subsidy through the government, which means that their, income is up to, it used to be a certain percentage of the federal poverty level, but now, through the expansion, due to, government, new bills being passed, that it's now a percentage of income. So if it's, I believe it's somewhere around 9% of their income, if their health insurance premiums are higher than that, then they can qualify for the subsidy. But if their premiums are lower than the 9%, then they have to pay the full premium for their plan. And so, there's lots of different nuances from the people that have the lower income. As much as I can, I want to see them onto to get a silver plan. Uh, so there's like when they created the Affordable Care Act, they created these what they call metal levels. and they have a bronze plan, a silver plan, a gold plan, and a platinum plan. And the idea was that the bronze plan would have lower premiums and higher out-of-pocket costs, and the platinum plans would have higher premiums and lower out-of-pocket costs, and that's true.
Mm.
However, the premiums have gone up so much since 2014 when this first started that even, for the most part, the majority of my clients are either on the bronze plans or the silver plans. The instances where I recommend the silver plan is when their income is below 200% of the federal poverty level, because at that income level, it affords them what are called, if they get a silver plan, they also have cost sharing reductions, which means that their out-of-pocket costs are greatly reduced. And so, they do have to pay a higher premium than a bronze
Mm.
plan. But, when they use their health care, they have much lower out-of-pocket caps and co-pays and whatnot. I did have a client where she did qualify for the silver plan. And she's like, oh no, I don't want to pay a premium. Get me the zero premium plan. And I'm like, okay, if that's really what you want, I don't really recommend it. And, didn't really think anything of it. And then a year or two later, I was talking to her and she was like, oh yeah, I was, I forget what it was, but she had, I don't know if it's appendicitis or something where she had, some acute thing happen where she had to be hospitalized and was still paying off those bills. Whereas if she had had the foresight to have gotten the silver
Mm.
plan, that would have been already, there she wouldn't have any outstanding bills at this point. So sometimes as much as you try to, explain things to clients how they work and what's in their best interest, sometimes they don't always see it your way. But
Yeah. I've been really pleased. I'm on the traditional supplement, not Advantage,
hmm
and have had several tests and a couple of hospitalizations recently. And two things really please me. One is I don't think I've had any out-of-pocket expenses. And number
hmm
two was I really felt like I was getting, I wouldn't say concierge treatment, but I I wasn't getting the bum's rush. I felt like I was getting really good care and
hmm
top-notch facilities. Um,
right.
so I think it's because they are paid. It wasn't because I was so attractive, but it's because they're paid handsomely for Medicare patients in the hospitals. That's my conclusion.
Right. I mean, I think that, the providers like to deal with Medicare from the standpoint that they tend to have less complication with the bills that they submit. So that, Medicare is usually a fairly prompt payer. And there's usually a 2-month delay, but they kind of factor that into the process. Um, but that, they know that they don't have to get, the authorizations and whatnot to get things approved ahead of time so that they can, just order what they think that the patient needs and, know that it's going to be covered. So,
Yeah. Um, we're close to wrapping up, but I'm curious, since you have your career has spanned the Affordable Care Act,
mhm.
what do you think as you look back pre-Affordable Care and po not post, but current, how
So,
impactful has that law been?
right. So, I mean, I think that overall, I think the law has been a positive thing for our society. That, the thing when I was working as a captive agent with one insurance company, we had to, gather all of people's health histories and submit it to the underwriters to see if they would get approved. And oftentimes I would even just in talking to the client I would know ahead of time, what are the, some of the knockout conditions were. And just, it broke my heart to have to tell them that, there really wasn't any insurance that would be available to them. And, that, you know, in a society such as ours that really, shouldn't be something that anybody would need to encounter is that, you're uninsurable, you can't, get insurance. The whole reason that we have insurance is not to pay for the, doctor visit every now and again, because most people can figure out a way to pay for that. It's the, oh my God, what if I was, had a heart attack, or I had, this happen where I'm incurring, tens or hundreds of $1,000s of coverage. That's beyond what most people can bear, and that's what insurance is for. So, so fortunately now with the Affordable Care Act, everybody can get coverage. The question is, can everybody afford the coverage? And so the the premiums from before the Affordable Care Act to now have gone up, and I don't know what the percentage is, but a considerable amount. So, for somebody that's not eligible for the subsidy, compared to what the premiums were before the Affordable Care Act to now, they're tremendous, they're tremendously higher. So not only are people paying more per month, but there's also a bit less flexibility in the plans that the insurance companies can offer because they have to adhere to the rules of the Affordable Care Act. And so the, one of the things that's set by the federal government is that upper limit or the maximum out of pocket. And the, for the most part, the bronze plans, started in the, I want to say $6,000 to $7,000 range, and now they're over $9,000. And for the majority of my clients, if they have to pay $9,000, they don't really have access to extra funds to do that. So it's just sad to see that, it's when they call it Affordable Care Act, it's almost gotten to the point where it's affordable for whom. So we went from the uninsured population used to be people at the lower end of the income spectrum, where now, due to the high government subsidies, they're able to afford their coverage. And not only can they afford the premiums, they can afford their out of pockets because that's all, heavily subsidized by the government. It's the people in the middle. It's the people in the upper, income range that just, isn't quite, really well off, that they can afford their, to have everything. And, so we're once again, unfortunately encountering some people that are, saying, the premiums are too high and I can't afford it. And, so it's, that's, starting to wear on my heart, and, to really, I wish that there were more that could be done. But, there's still, everything has to be done within the law. And they, there's just, it's just not a good situation for some people. It's, where they're having to choose between, do I pay my rent or do I pay my health insurance? And so it's, yeah, that's a tough situation.
If people want to reach out to you, are you licensed anywhere other than the state of Florida or just Florida?
I am licensed in one other state, but Florida is where I'm based, and I really feel that I can help Floridians better than I can help people in other states. I just had recently gotten licensed in another state because the client had moved there, and it was, just to help that one particular client, but I'm not looking to grow my business there. So
So
um
how do people reach you? Give us your email, phone,
okay,
website if you have one.
I certainly can. So well, first of all, my phone number is 941-302-2661. My website is srqhi.com.
Say that
My
again, just because sometimes it's hard to discern.
Sure.
Say that.
The website is srqhi.com. Uh, for people that aren't aware, SRQ is the airport code for Sarasota, Bradenton. And HI was just shortened for health insurance. So, yeah, I wanted just something that was quick and easy to type, because my email address that I use is my business name that I'm licensed with the state by is J Blum and Associates. So it's J. My last name is spelled BLUMAND, Associates, ASSOCIATES @gmail.com.
Great. And we'll put that down in the show notes
Okay,
so
very
that if
good.
people want to look that up, they can do so. Well, this was very informative, and hopefully there are a lot of seniors out there or approaching seniors that can take advantage of your expertise. I really appreciate you being on the podcast. So thank you very much. And
Well, thank you for asking me, Mark, and I really enjoyed having this conversation with you, and look forward to seeing you again real soon.
Great. So thanks everybody for tuning in to the Thrive Co-Living Communities podcast. I'd like to thank my guest, Janet Blum, for being with me and all the good information you provided. If you like the podcast, please give it a thumbs up, subscribe, and click the notification bell. And we'll see you next time on the Thrive Co-Living Communities podcast. All right. See you guys. Thanks for joining us for another great episode of the Thrive Co-Living Communities YouTube podcast. To learn more about our mission and how you can support our vision of creating co-living communities worldwide, please visit us at thrivecolivingcommunities.org. To receive advanced viewings of our podcast and other exclusive content, find us on Patreon at patreon.com/Thrive Co-Living Communities. You can also learn more ways to support our mission in the show notes below. Amazon Smile, GoFundMe, Kroger, and our own Thrive Gear store, where you can buy t-shirts, hats, and many other items. Thanks again for tuning in, and we'll look forward to seeing you again soon.